First of all, what is chloroquine?
Well, basically, this is very exciting. The bottom line is chloroquine is a medication that's used for malaria. It's used for the prophylaxis and the treatment. I prescribed it for a lot of my patients in the past who are going to malaria, areas where malaria is very prevalent, such as different parts of Africa, to basically make it so that they don't get malaria by taking this medication. This is very exciting because the deal is the research is showing that this chloroquine is actually helpful at preventing and even treating COVID-19. Now, the deal is it has to go through FDA approval to get the label for the treatment, but it can be used once it's confirmed that it is effective for what's called off-label treatment.
Now, how long does it take to get something like this confirmed? Will they try to fast track this, or could this be months or even more than a year down the road?
Well, most definitely, they will try to fast track it. When I say they, I'm referring to the FDA. But I actually spoke to one of my colleagues that's an infectious disease specialist today, and he confirmed, as was confirmed earlier on the news, once it's confirmed that this medication is effective, because the medication is FDA approved for a different indication, which is malaria treatment and prophylaxis, the physicians can now use it for what's called off-label, meaning it has not been approved to treat for the indication of treating COVID-19, but it can be used off-label to treat COVID-19 if indeed it is confirmed that it is effective, and it's looking like it's going to be effective. So, hey, help is on the way.
All right, a little silver lining there. You know, a lot of people are pretty worried about this whole COVID-19 pandemic, a lot of anxiety going on out there. What would you do to somebody, or what would you say to somebody who's feeling a little bit anxious right now?
Well, basically, education. I actually had a sit down with the chief of Jackson Police Department, and we talked at great detail because a lot of his officers are getting a little fear and anxiety going out into the community doing their job, protecting the community. And we talked about different measures as far as education, reassurance, and just reminding people that the World Health Organization has confirmed that up to 80% of people that get this infection have mild to moderate symptoms, meaning for most people, it's not a death sentence. But we still have to be very adamant about decreasing our exposure because for most people, such as our officers that are going out to protect us and others, we don't want to be carriers getting the infection and giving it to people who are more vulnerable, such as the elderly population with other medical conditions, because in this case, it can possibly be deadly.
And what do we tell our kids when they ask us about COVID-19 or coronavirus? How do you approach this with a child?
Well, basically, once again, education. I mean, we have to talk to our young people. I actually have a daughter who is in college in New York, and hey, she's staying with us right now, and she's getting bored. I have nothing to do, Dad. Yeah. And it's so funny. My wife, she's now instant stepmother, and she's so wonderful. She's jumping in there doing a great job. But the deal is, what we have to do, like I'm doing with my daughter, is just help her understand that, you know, first of all, you know, for most people, especially young people, it's not a death sentence. So, you know, we can release some of that anxiety, but at the same time, encourage them to just try to find other things to do to occupy their minds. Not too much social media because it's going down Facebook and Instagram 24 hours. Not a whole lot of news. Make sure you watch WJTV news. But other than that, let's just keep it to a limit and try to do things to engage our minds. Luckily for us, my daughter is going to be doing online coursework. Her school in New York is going to allow her to do online. But for others, especially the younger kids, let's just keep them engaged and just keep them active and keep their mind off of it as much as possible.
All right, Dr. Timothy Quinn, thank you so much for taking a few minutes with us this afternoon. Practices family medicine up in Bridgeland. We always appreciate a visit from the doctor. 12 News continues right after this.